Hi, we're Advantage Physical Therapy and Rehabilitation, and we are partnering with the running store to bring you these videos to help runners be more mindful of their body and the conditions and symptoms they may have while training. My name's Corinne Knight. I'm a physical therapist at Advantage Physical Therapy.
And I'm Ashley Osburn. I'm an exercise specialist.
And we're going to talk about plantar fasciitis today. Plantar fasciitis is a common overuse injury that happens not only to runners but also other individuals. What happens is the fascia that runs along the bottom of the foot that helps create the arch will get irritated and strained, especially with overuse. So when you are training for those long runs for your marathon and the continuous miles that some people do while they're training, you can find that it's really irritated. Most symptoms you will find will be in the morning, after you've had a nice long sleep, or after resting with your foot for a while, or say about mile 5, 6, or 7 during those races, those training. So what we're going to do is show you a couple of exercises you can do for your foot. The first one you can do is at night. My usual regimen I encourage my patients with plantar fasciitis to do is to start with a 3-day regimen. So every night for 3 days you're going to take a golf ball. And you're going to put that golf ball on the bottom of your foot. And this is really painful, but what you're going to do is you're going to continue to roll that golf ball along the bottom of your foot where the plantar fascia is until it gets sore. What you're doing with that soreness is creating irritation and fresh blood to the area to push out the chronic inflammation you have there. So it can last anywhere from a minute to 5 minutes depending upon the severity of that pain and the inflammation you have. After you're done with that, you're going to follow it up with ice. Ice is always great for inflammation. You should never ice longer than 20 minutes. And you're just going to roll, and we have here a frozen water bottle along the bottom of your foot. Okay? And Ashley's doing a great job. Ashley, our runner, is doing an excellent job just running that nice cold, right, water bottle on the bottom of the foot. Okay, a couple other things you can do is you can massage your bottom of your foot on yourself. So you just cross over and just really dig your thumbs into that area. There's no specific area to focus on. If you're going to, right here is where the plantar fascia inserts, and it comes all the way out to your toes here. Just give it a good rub. You can do that before the golf ball. You can do it during the day. And now here's a couple stretches that you can also do. There's one which is called the runner stretch. It's your classic standing stretch. We're going to come over here to the wall, and Ashley's going to show us. You're going to put the involved leg behind, and your goal is to keep your heel down. With this one, your back leg is straight, and what you do is you lunge forward from the hips. You're going to feel a nice stretch to this whole calf here. Research shows you need to hold a stretch for about 90 seconds to create tissue change. Nobody has time for 90 seconds. So usually with my patients, I tell them 3 times 30 seconds. And of course, you always want to do both sides. You don't want to be uneven. The other stretch you're going to do, thank you, Ashley, we're going to do the soleus stretch next, is the soleus stretch. It's another muscle that is in your calf. And you change the stretch by still having the involved leg behind, but your knee is now bent versus straight. And once again, 3 times 30 seconds. Now, these are both for the muscles that are on the other side of the plantar fascia, so it's like a pulley system. Now we're going to go back to the plantar fascia, and we're going to stretch the plantar fascia. This is what you do for this one. You're going to take your foot up to the wall, you're going to stick your toes against the wall, and just push your foot into it. You're going to feel all along the bottom of your foot there, and all along the bottom of your foot there, a nice stretch. And once again, like I said before, 3 times 30 seconds, okay? If you have any more questions, you can email us at Advantage Physical Therapy and Rehabilitation, or you can just give us a call and be more than happy to answer those questions. Thank you so much, and have a great day.
Bye!